Survival rates from breast cancer differ in many parts of the world greatly. Women in better developed nations have a greater chance of early detection than those in poorer, less developed countries. Let's talk about this with Dr. Arafat Tfayli, a cancer specialist at the American University of Beirut. Dr. Tfayli, many thanks for taking the time to speak to us. Early detection is key when it comes to successfully treating breast cancer, but it really depends where you live in the world. What are you hoping to come out of this campaign?
Thank you, Paul, for inviting me, and thanks for raising this very important subject. And really, the disparity in access to screening and treatment is really immense between the better developed countries and the less developed countries. And even within specific countries, you can see big differences. It all depends on how well developed the healthcare system and how educated the women are when it comes to breast cancer screening. Huge differences, as you mentioned, with screening, we have better chances of early detection and definitely better chances of cure from this cancer.
What kind of impact has the pandemic had on outcomes? Are we seeing people dying in what, in many cases, is a preventable disease?
It's a little bit too soon to tell from that. What we know is that during the first few months of the pandemic, yes, there were fewer screening and fewer cases detected. And then things picked up in the later part of 2020 and early 2021. But to look at the effect of that on survival is a little bit too soon. This needs to be followed over several years to see the effect on that. But definitely there were fewer screening tests and fewer cases diagnosed with early disease.
It might seem basic advice, but what should people be checking for and how often should they be checking?
To be honest, probably the best advice you can give for a woman is to know her breast. Really know the shape, how it looks, how it feels, and how the consistency. And if she notices any change, to immediately go for a imaging and a checkup. This is, of course, not to undermine the role of screening before she gets any symptoms. But in women who don't have access to screening or they live far from a screening center, really, whenever they realize anything different or they feel any lump in their breast, to go for an immediate checkup. And this really makes a big difference in the outcome of this disease.
And which parts of the world are really lagging behind? Were there any countries, for example, that were doing very badly compared to others?
It all depends on the socioeconomic status of the country, really. So the less developed countries, more in Africa and some of the Southern American countries where the economic situation is harder, is less developed. Really, you see the screening programs are still struggling and at their infancies. Where in the more developed countries, these are much more established systems. But even within specific countries, really, we did a study in Lebanon 3 years back. In the urban areas, screening is much more common than in the rural areas. So the farther you live from the capital or the farther you live from a major city, the less likely the woman was to undergo a screening test for breast cancer.
OK, thank you, Dr. Tfayli. We'll have to leave it there. Thank you so much for your perspective.